what types of diabetes-specific concerns have patients been seeking help for during these wild global pandemic times that we're currently trying to figure out?
Yeah, so it hasn't been a whole lot different than normal, but certainly a lot of the conversations that we've had are around anxiety around COVID, and and how, and especially over the past week, how the current unrest has been impacting people's just feelings of safety, which certainly impact and comfort, and that certainly impacts and the stress, and how stress impacts their diabetes management and their blood sugars. But other than that, other than that specifically, generally speaking, the issues that we've been dealing with are really the same: diabetes distress, diabetes burnout, adjusting to diagnosis, fear, concerns about relationship with healthcare providers, guilt and shame. But certainly those stresses have been amplified by the current times.
Mark, what do you think is misunderstood about mental health in people with diabetes?
Lots, especially for people who don't live with diabetes or don't know somebody, have a close person in their life who lives with diabetes. The first is that they're connected, and that having diabetes, the diabetes is not only a physical condition, but it's also a mental condition. The burden of diabetes management, or and actually I'm trying not to use the word burden as much anymore, but the workload of diabetes management can be overwhelming sometimes, and that staying mentally healthy is an important consideration to staying physically healthy with diabetes, and when you need to address mental health issues at the same time that we address physical health issues. The second thing is that these challenges are normal. Diabetes is a stress, and that when people are experiencing challenges with diabetes, oftentimes that's a normal reaction to stress. And we often pathologize that, and certainly we want to help people to deal with the stress better, but it's not a pathology. Living with stress and diabetes, that's a normal part of diabetes, and there's just no way around that. And so we want to help people to understand and normalize that's the case. Next, that these things exist on a continuum. Certainly, there are some people who have major mental health issues related to diabetes. And I think that the best example for that, on the far end of the continuum, would be somebody who doesn't take insulin to lose weight. And that is both, that is extremely dangerous physically. It can send you to the hospital and possibly worse very quickly. It's also a very serious mental health condition. But I think that everybody with diabetes, or most people with diabetes, especially type 1 diabetes, have some sort of stress, whether it's just kind of some negative emotions, frustration, feeling alone, feeling isolated, feeling different, to having kind of some major issues, and everyone in between. And so I think that we need to see that it exists on a continuum. And then, of course, that there's with mental health issues that are related to diabetes, how important it is for the treatment provider to understand what diabetes is and how it's treated, because you can't use a one-size-fits-all approach here, and certainly we want to do no harm, and oftentimes by not understanding what diabetes is and how it's most effectively treated, and also the language around it, the culture around it, you're going to be talking at cross paths, and therapy, generally speaking, will be less effective that way. So that was kind of a mouthful, but I think there's a lot of things that are misunderstood, especially certainly by people with diabetes sometimes, but also by people who don't have diabetes, who are struggling to understand what the big deal is. And it is a big deal.
Yeah, oh, that was lovely. The other thing I would tack on that I think touches on some of those is I think people don't understand how interconnected diabetes is with the rest of life, and in reverse. So just to give like a simple example, like if I'm anxious and find it harder to fall asleep, and I sleep poorly, and then sleep connects to blood sugars in like a really strong way. So the next day I might have like much higher blood sugars, but then of course my blood sugars also influence my mental state and emotional state. So like for me, like when I'm high, I'm pretty grumpy, and I just know that. And then, of course, all of that can build further anxiety or further stress and then make it more difficult to fall asleep. And so, like, I think there's a lot of positive feedback loops that happen in diabetes. Like, the coping strategies make the problem worse, or the coping strategies in this area influence this other thing over here. And all of that ties back to diabetes.
Yes.
And I think there's often this oversimplification of like, well, just count your carbs and take your insulin and check your blood sugar and you'll have on target numbers, that ignores like how tightly connected the web of diabetes in life is.
Yeah. Oh, and even if you have on target numbers, it doesn't mean that don't have emotional challenge related to diabetes, because, I mean, for lots of reasons, which we don't have to go into now. So, and I think that it's important for physicians to understand that, and I'll hopefully always ask their patients the question of, how you doing? How is this impacting you emotionally? Even if blood sugar numbers are right on target.
Automated insulin dosing systems, either in development or actively available. One of the goals across the board is to take on some of that burden, some of that process of diabetes management. How have you seen conversations with your patients change as hopefully in the case of any sort of success with automated insulin delivery systems or dosing systems, whenever patients are able to offload some of that, have you seen how patients or conversations are changing because they're devoting a little less time, no matter a lot or a little less time to diabetes management, they're able to focus on other aspects and potentially adjust the nature and scope of conversations that they're having with you?
Yeah, I mean, I only have some anecdotal observations here, but the patients that I have who have started on automated insulin delivery have definitely noticed a decrease in cognitive burden and kind of cognitive load in related to diabetes management. And so that's been for many of them it's been a game changer for them. And their diabetes distress, especially around low blood sugars, around waking up, around sleep, have really increased. Have really gotten better. And so I've seen nothing but good things. Certainly, the issues that come up are around trusting the system and making sure that that what's happening is that they're comfortable with, both in terms of the blood sugar, but also in terms of their anxiety, because taking that hands-off approach, I've heard and I know can be a little bit anxiety provoking, but generally speaking, with a little bit of time, I've seen that go away. But at the same time, I think that it's important to recognize that automated insulin delivery does not all of a sudden take away the mental health burden of diabetes and the emotional burden of diabetes. A lot of the guilt and the shame and the stress and the embarrassment, that's still there. Or it may actually even be there more. Someone who wasn't using a pump before now has a pump on, and that's a physical reminder that they have this invisible condition. For a lot of people, that actually brings on some more stress. And so I don't want people to think that automated insulin delivery is amazing. I use it, and it's been a game changer for me. But I don't want people to think that if we put people on AID systems, that all of a sudden their emotional burden is going to disappear.
That is, yeah. There's a lot to unpack. It's a whole other webinar. One more question in from Paul. Thank you, Paul. Mark, can you comment on the impact, if any, of mindful meditation on diabetes management? I mean, there are apps out there like Calm and Headspace and things like that that are that sort of focus on that specific aspect of mental health. Any impact, if any, that you've noticed from people either using those apps or engaging in more direct mindful meditation?
That is my favorite question. I love mindfulness, and I love talking about mindfulness in relationship to diabetes. For those of you who don't know, mindfulness is paying attention to your experience in the present moment without judging it. And I think that mindfulness has such a huge impact on diabetes management. There are so many benefits that you can use, from paying attention to what your reactions when you see your blood sugar number on your CGM or on your meter, to noticing how you feel when your blood sugar is high or low, and not judging your experience, but just taking the action that you can to change what you can, and also recognizing that there's some parts of the experience that you can't change, and to be okay with that. And so I'm a big fan of using mindfulness in terms of in helping people manage diabetes and especially around acceptance of diabetes. I find it to be especially useful for people who are overwhelmed with diabetes and the cognitive burden of diabetes, as well as people who are struggling to accept the fact that they have this condition. I've seen a lot of patients recently who are newly diagnosed in their 20s and 30s, and for them that adjustment is challenging. And so using mindfulness as a way to help them to accept their new normal and to embrace it, rather than to try to avoid it or push it away, has been extremely helpful for them. So I can talk for probably another hour about mindfulness, but those are the ways that I have found it to be very helpful. I think that the apps out there are awesome. I use Headspace personally, but Calm and Fabulous is another one that has mindfulness integrated into it, are all great options. And I think that one other thing I will say about mindfulness is a practice, which takes practice. You can't just say, I'm going to be mindful today. You really need to practice that skill. And so using an app or using some sort of an audio program to help you to practice that mindfulness skill will help you then to use it in your everyday life with diabetes when those types of stresses come up.